Welcome to our lecture today about hyperkalemia. Hyperkalemia is seen very frequently in the hospital, and usually patients present to the ER with vague symptoms. Always think about it when you have a patient who has end-stage renal disease, missed dialysis, and patients usually tell you, I'm either fatigued, tired, muscle cramps, and detection of hyperkalemia is very easy because once you do basic metabolite panel, you'll be able to find that their potassium is high. Now on EKG, it's very important to be aware of those changes. Once the level goes above 5, patients start having the T waves become tented like that. And the T wave, you can recognize that's even higher than the peak of the R wave. Next, you will start losing P waves. P waves start becoming flatter, and then they might end up becoming with the isoelectric line. If the potassium goes up above 7, you will see that the QRS has already lengthened. So this is what they call a wide QRS. And if your patient is very unfortunate, you might see this pattern, sine wave pattern. So basically, if you remember in mathematics, the sine wave starts like that. And this is exactly what you will be seeing on EKG. In that case, your patient is very close to get VFib and cardiac arrest. How do you treat hyperkalemia? First of all, you have to protect the cardiac muscle, and this is why you give calcium gluconate. Number 2, you give them dextrose 50 in addition to insulin. I usually give D50 and 10 units of IV insulin. Don't give it subcutaneous because it's going to take time, while IV will act rapidly. If a patient has end-stage renal disease, I give them 5 units so that they don't become hypoglycemic. And then you can give the patient caoxalate. Caoxalate acts by binding to the potassium in the gut, and it will be released in feces. So if your patient is NPO, this is not gonna work really quick. Also, this will take some time to work. If your patient is in terrible shape and the patient is end-stage renal disease, it might be worthwhile to do emergent dialysis, especially when the levels are so high, like in the range of above 7 and 8. Thank you for watching this video. If you have enjoyed watching this video, don't forget to like it, share it with your colleagues, and subscribe to our channel.